Welcome to this deep dive. We get straight to the heart of things, and today we're really focusing in on breast health,
Hmm,
specifically for you. And we know navigating this can sometimes feel a bit different, maybe, especially if you're dealing with hormonal conditions like, say, endometriosis or PCOS.
absolutely. And it's completely understandable if you sometimes feel, a bit confused
Yeah.
or maybe even anxious about figuring out what's normal versus what needs attention.
Yeah.
So our goal today is simple,
hmm
clear, non-alarming info. We want to empower you with some straightforward steps. We've been looking at some guidance from March Health for this.
Okay, good. So let's dive right in. What should we actually be aware of with breast health? And the idea isn't to cause worry, right?
Not at all. It's really about getting more familiar with your own body. What's your normal? March Health points out a few key areas to sort of keep in mind.
Like what?
Well, first, changes in breast size or shape. The key thing here is knowing what's typical for you.
Hmm,
What's your baseline?
right. Everyone's different.
Exactly. Also, any new lumps, bumps, or maybe thickened areas that could be in the breast itself or in the underarm area too.
Okay. And lumps can sound scary, but
Well, yeah, but March Health does emphasize that actually the vast majority of lumps, we're talking like over 90%, turn out not to be cancerous.
mm,
They're benign.
that's reassuring.
It is. But the advice is always get them checked out by a doctor, just to be sure.
Makes sense. Okay, so beyond lumps, what else did March Health highlight?
Nipple changes are
Sure.
another one. So this could be any discharge that isn't breast milk, obviously,
Mm.
or if a nipple suddenly starts pointing inward, retracts. Or
Okay.
just any other changes in how the nipple looks.
Got it. And skin changes.
Yeah, skin changes on the breast itself. Things like dimpling or maybe some puckering, redness, or even like a scaly texture. March Health flags these as things that definitely warrant attention.
Okay.
And one more, pain. Specifically pain in one particular spot in the breast that just doesn't go away.
Hmm. Because general tenderness is pretty common, right? Especially
No.
with cycles.
Totally. General soreness, quite normal for many people. But this is different. It's persistent pain localized to one area. That's something to monitor.
Okay. It does feel like, a bit much sometimes to figure out what's significant and what's maybe just normal variation.
It really can. And March Health gets that. They actually acknowledge that uncertainty or anxiety people might feel around breast checks. They normalize it. It's okay not to be 100% sure all the time.
That's good to hear. So, knowing that, what are some simple steps March Health suggests just to help us get more in tune with our bodies?
Right, simple steps.
Yeah.
The first big one is just becoming familiar, knowing how your breasts usually look and feel, establishing your own baseline.
And self-exams can help there.
Regular self-exams are a good tool for this, and March Health actually suggests doing them at different times in your menstrual cycle.
Oh, interesting. Why?
Well, it helps you understand how your hormones might affect things, those cyclical changes. Especially relevant, as you said, for people with hormonal conditions like endo or PCOS.
Makes sense. Okay, so know your baseline. Then what?
Then simply pay attention. Notice any new or unusual changes, anything different from your baseline.
And the advice isn't to panic if you notice something.
No, definitely not panic, but do make a note of it. Be aware.
And they had a practical tip too, right? About keeping track.
Yeah, exactly. They suggest maybe keeping a simple log, just jotting down any symptoms or changes you see.
Mm,
March Health points out this can be super helpful information if you do decide to talk to a doctor. Especially, again, for those with hormonal conditions, tracking changes over your cycle can be really insightful.
that's a really practical idea.
It is. And one more thing on appointments, if you do have one book to talk about breast health, March Health encourages you to, write down your questions beforehand.
Good advice, so you don't forget in the moment.
Exactly. Ensures you get the info you need.
It's also important to touch on the fact that, well, sometimes navigating the medical system isn't easy.
That's a really crucial point. March Health acknowledges that some people might have felt dismissed or maybe not fully heard in the past.
Yeah.
They want to validate those feelings. And they really emphasize that their aim is to be a trusted, supportive partner on your health journey.
That's really important. So wrapping up then, we hope this deep dive, drawing on those March Health insights, has felt helpful, maybe a bit reassuring.
Yeah, hopefully. Remember, getting to know your body, it's not a one-off thing. It's a process. And just being aware of changes, that's a really positive, proactive step for your health.
Definitely. And for anyone wanting more personalized support, maybe some tools, March Health does encourage checking out their app. It's designed as a companion for navigating your health journey.
hmm So as you go about your day today, maybe just take a moment. Think about one small thing you could do to become just a little more familiar with your own body. What's one question you might ask yourself? Something to ponder.